Okay, hi, my name is Jalen Morales, and the article that I have chosen for this presentation is The Effects of Energy Drinks on the Cardiovascular System. Introduction. Importance. The experiment done within this paper is important for several reasons. One, energy drinks have risen to prominence within the past few years with young adults using them as tools to stay awake for jobs or for school. Number two, the public has become concerned with the health effects of overconsumption of energy drinks. Number three, there has also been concern of how much high caffeine intake is being normalized for adults and even teenagers. The authors. There are several authors in this article, and I apologize for any butchering of their names. The first author, Shokofe Hagrizasti, is the lead author, who is a professor at the Iran University of Medical Sciences and has published many works about cardiology. The second is Fatemeh Mohamedpour, who is a pediatric neurologist who works at Boston's Children's Hospital and has many notable works about neurology. The next authors are Mohammad Javad Monteji, Morteza Hassandi, and Ilham Rahmani, who are also professors at the Iran University of Medical Sciences and have published 3 other works in collaboration with other authors and the same authors. The next is Kirashi Koshagiri, who is part of the faculty of the Tehran University of Medical Sciences, also in Iran. And the last author is Mozor Tokesambani, who is a researcher that works at a Center for the Prevention of Cardiovascular Diseases. Now, why did I choose this paper? Well, from the image in the slide, it can be shown that I have a congenital heart defect called hypoplastic left heart syndrome. This heart defect made it so that I would have 3 open heart surgeries, and I'm a single ventricle patient, meaning that only one ventricle is supporting my whole cardiovascular system. So growing up, I was always surrounded in hospitals and also doctors who, as I got older, tried to emphasize to not drink energy drinks or to have a low consumption of them if needed. So I chose this paper because I was curious about the effects of energy drinks on healthy people, not exactly people like me, and I also want to become a cardiosurgeon in the future, so that interested me about this paper as well. Now onto the methodology of this research paper. So this article is presented as a quasi-experiment, which means there is no placebo or control group. The subjects of the experiment were randomly chosen on 4 different university campuses in Tehran, Iran. They were between the ages of 15 and 30 and were healthy individuals with no cardiovascular diseases. They did not take any medication that could affect the cardiovascular system. They had no history of substance abuse or having regular alcohol intake, and the women were not pregnant. Now, once the participants were chosen, they each had their heart rate and blood pressure measured and then underwent an EKG recording. Then, once all that data was collected, they were given 1 can, 250 milliliters of Red Bull to drink, and all measurement and recordings happen at certain time intervals, such as 30 minutes, 2 hours, and 4 hours post-consumption of the energy drink. So what's the methodology good, and what would I have changed? So I say yes, the method of the experiment was good, as it was simple and easy to measure the results of the short-term cardiovascular effects of energy drinks. However, I would have changed that I would want a more diverse sample group, such as those with cardiovascular diseases, chronic illnesses, and a certain amount of men and women to see how each specific group is being personally affected. This would have also been better to replicate the general population to get more accurate results. Results and statistics test. So the results of the paper showed the participants' heart rate decreased significantly. The EKG also had noticeable changes in measurement, with more people showing abnormal ST waves. However, there was no significant changes in the measurements of blood pressures or other heart readings by the EKG. And the statistics test done within this article is the paired t-test, which means a test compares 2 sets of related data to see if the difference is statistically significant for accurate results. So the data that was being compared in this article was the data before consumption of the energy drinks and the data at each time interval after consumption of the energy drink. The tables. So in Table 1, we see the baseline characteristics of the study subjects, which is their age and their gender, male and female. And in Table 2, we see the cardiac rhythm and how there seems to be discrepancies after the consumption of energy drink and at each time interval for different participants. We see in Table 5 the frequencies of STT changes within the EKG and how there is changes in the stress on the heart in multiple participants in the study. And then in Table 6, we see certain participants and how they were personally affected after consumption of an energy drink. Discussion. There was a significant decline in heart rates, which may have been caused by nerve stimulation or an increase in stroke volume due to the consumption of the energy drink. Blood pressure was not changed, but that might have been because of the dosage of the energy drink was too low because it was only 1 can. And the EKG results did show some increases in stress, which may have indicated more stress on the heart caused by the energy drink. And I think that the results are strong as they are backed up by the statistics shown in the tables before. However, the study does have some limitations because of no control group and a low dose of caffeine. Discussion continued. The researchers did expect these results as they knew their study had limitations with the amount of energy drinks consumed. They discussed that many studies that show harsher results are because they study long-term effects of overconsumption of energy drinks. And I did expect these results because of my environment and constant warning from my own pediatric cardiologist and hospital team. I also believe the main factor of the study that should have been changed was to ask the participants to drink multiple energy drinks so that we could see the overall effects of the overconsumption of energy drinks that is being normalized in our society, as most people have multiple energy drinks a day rather than just one. These are my references for the article, and thank you.